Enhance your look, enjoy your life. GeorgiaPlastic.com.
Alrighty guys, so we are back with Dr. Park, still on this male liposuction case. 360 lipo. He's already done lipo on this patient's posterior waist. Now we are working on his abdomen. He's also getting his chest as well, bringing in his waistline and really giving him a nice flat appearance in the abdomen. This patient has had a lot of fat removed already. And he is also getting laser liposuction, which is really going to help to melt out some more fat, lost those fat cells, and really shrink that skin. Make sure that tissue does retract post-op. And laser liposuction can also potentially be performed on its own, depending on whether or not you are a candidate. But normally we combine that with the power-assisted lipo. Hey, thanks for joining us. Shout out to Batesville, Mississippi. What's the weather like in Batesville, Mississippi? It's pretty rainy over here. It doesn't feel like we're in Atlanta. It feels like we're in Seattle, really, with all the rain. So because we are full on the canister, we are going to go ahead and transfer this out of fat transfer. Oh dang, it's doing the same over here. It's doing the same over here, I do not know. It's like we don't even have a winter, we're just having rain. So it would depend on like how many other areas you're having and what other procedures you're combining that. Sometimes we have a special where you can get one complimentary area of lipo with your tummy tuck purchase, so that could be something that could help with the rolls, but that would kind of be one area. Like your bra rolls would be one area, and then your posterior waist would be another. But then again, it does also just depend on how many areas you're getting done and what those areas are, because sometimes maybe we can comp something and, you know, work with you. So let's say you're getting like your armpit roll or something, then we might want to go ahead and just get those bra rolls while we're there in that area. Absolutely. So having liposuction does not affect your fertility or doesn't have any sort of interference with your uterus or anything like that. So you can most definitely get pregnant after having liposuction. If anything, we always joke that people will have their BBL, their tummy tuck, or their lipo, and then come back to see us after they've had a baby or after they've gotten married because they look so good. They end up needing more due to pregnancy. So it's very common that people come back after having children, especially with liposuction. This patient in particular is pretty young, and a lot of our younger patients come in and have lipo and, you know, have no issues later on in life having children Of course, you may want to plan things out a little bit. You don't want to spend a whole lot of money and then get pregnant next year just to have to come back maybe a couple years later. So it might be better to, you know, if you're planning on having children in the next couple years, maybe wait, have the baby, and then come back and have your lipo, have your tummy tuck, or your overall mommy makeover. But you can definitely get pregnant. This does not affect your fertility. Oh, thank you so much. Thank you for joining us too. I appreciate you. So the inner thighs would not be something that would be included in like one area. It would be like maybe your upper and lower abdomen, then we'll do like the waistline. If you're wanting your thighs, just lipo on the thighs, that might be able to be combined depending on your health standing and how much fat he has to remove. But that might be something that you go ahead and stage or break up. So we could do your tummy tuck first, and then you come back in a few months, and then we go ahead and do the thighs. We have also done thighs under local anesthesia, where you don't have to pay for or have to go under general anesthesia or be completely asleep, like with this patient. If you go over to our YouTube channel, we have a really good video of a thigh lightening or thigh lipo case where she was awake the whole time. And she had not only the power assisted lipo, which is what Dr. Park is doing now, but she also had laser liposuction with the smart lipo machine too, that really tightened up the skin. Sometimes after having all of that fat sucked out of the thighs is an area that the skin doesn't retract as well. So sometimes we want to go ahead and do like a thigh lift, which is kind of like a tummy tuck, but it's a tummy tuck situation on the thighs. So we'll cut out the excess skin, but that's a very rare case just because it's a very long incision, and it's not like it's on your tummy where it's really low. And a lot of the times people can even wear a bikini after having a tummy tuck, but with the thighs, you know, it's going to be, even if you wear shorts, they're still going to be able to see that. So it's very rare for us to do thigh lifts unless you've had massive weight loss and have a lot of excess skin for us to target. Oh yeah, then we can just do lipo and laser. And laser is really good because I'll show you the laser machine. Actually, it doubles as our cellulase machine, which it can I'm gonna go over there and show you. So the smart lipo machine is also a cellulase machine, so that can blast out your cellulite dimples and really smooth everything out with it. So that's one thing that's really cool. If you want to DM me, I'll go ahead and send you the link in the messages if you want to DM me. But she was talking and she was really comfortable. It was really cool. It was done, I think, in like 2018, so it's kind of far back on the channel. It might be a little harder to find, but it was one of my favorite procedures whenever I first started working here, because she was like, oh, it just kind of feels like marbles. Like, she was so comfortable, and I had never seen an awake procedure before. And I'm personally a big baby. Like, I feel like even to remove a cavity, can I just go to sleep? Like, I don't want to be awake for this. So it was really cool to see somebody have lipo on their thighs, and they're just like, oh, I don't feel anything. This feels weird. I just feel a vibration. It was really cool. So he's bringing in his waistline right now. He's also going to be doing some sculpting on him as well. Okay, so for a nose job or rhinoplasty, normally it ranges at about $5,000 to $8,500 for a nose job. Depending on what your needs are, we also offer non-surgical nose jobs with fillers as well. But the thing about that is you're going to have to keep coming back, you know, every however many months or however many years to have that redone. So sometimes going through with surgery is better and more cost effective because you just pay more upfront, but you don't have to deal with, you know, the same issue frequently, like 10 years. You'll be fine. I know it kind of looks a little bit scary, or like it could be painful, but the patient is asleep. He is not feeling anything. And where he's putting the cannula is right under the skin. So for those of you guys who have some concerns about, you know, maybe something being punctured, or the cannula hitting you, hitting another organ or anything like that, that's not something that we're concerned with, because that cannula is just right under the skin. So we're targeting the subcutaneous fat. That's the fat right under the skin. We're not going in deep enough to be able to hit anything or anything like that. So that's why it's so important for you guys to choose somebody who is a board certified plastic surgeon like Dr. Park to perform your procedure, because you don't have to worry about those kinds of concerns. Okay, come on in for a consultation. Definitely come in for a consultation. There might be some revision options. You may also want to revisit the surgeon who performed it first, since he's already, you know, been dealing with you. Maybe he might have some options for you, but you can definitely come in and have a consult with us, and we can see what the surgery plan would be for that. Okay. Well, yeah, definitely come and see us. Definitely come and see us. Maybe not the crookedness, but sometimes if a patient maybe is having an issue with their profile, or maybe the length of their nose, we can use some fillers to potentially kind of, you know, give you a better profile, or maybe fix the tip of your nose. But if you're having an issue with your nostril, or something is crooked from like your face like straight on, then for that you would probably need surgery. Yeah. Yes, it is considered one area. Now that is something that's more for male patients. It's not really something that would be for the average female patients. Of course, we do create a surgery plan depending on your personal needs, and everybody's needs are different, but normally chest liposuction is more commonly seen in male patients. Now for women, we would need to go ahead and do like a breast reduction at that point. That's true. So that is why he is using his right hand to feel. A lot of surgeons will say that liposuction is very much by touch. Whenever he's feeling around, he's feeling where the fat is and where he needs to put that cannula to suck it all out. So that's why he's feeling all around his body, always feeling to see where the fat is left. We're not going in deep enough to go around your organs or anything like that. We're just right under your skin. A lot of the times if you kind of feel like your lower abdomen, that little pooch of fat, that little pinchable fat, that's what we're actually sucking out. So that's why he's feeling, to see where it is, where he needs to suck out, and just scraping that fat out. Oh yeah, you're very close by. We actually have a lot of patients who come in from Alabama. Very close by. Yes, your lower abdomen would be one area. And feel free to always shoot us a message if you have any questions about anything, or if you want to look at some pictures or anything like that. We'll be glad to assist you. We have a very awesome team here. Right now you are watching Dr. Daniel Park. He's performing this liposuction case. Assisting him, we also have our surgical tech, Subs. Hey, shout out to you, Subs. And behind the blue curtain, we have our anesthesia provider who's caring for the patient. And behind me, we have our lovely nurse. Each patient has their own nurse to take care of them from start to finish. And they also call your friend or family member to give them updates on your surgery, just to make sure that they're, clued in on everything that's going on. So a lot of the times, family members will watch live to keep track of their friend or family, and then also they're getting a million calls from the nurse as well. But you're so cute. Absolutely. So we do offer consultations via Skype. Absolutely. You can do a virtual consult and then come in whenever it's time for your pre-op and your surgery. We do. So the most common time that we have any sort of specials is during our anniversary event, which is going to be in May. But if you have your consultation and you get your quote, your patient care coordinator can kind of go over some different financing options or different ways for you to be able to afford your surgery. But our price range for the Brazilian butt lift, it is an all-inclusive package of like 4 to 5 areas of lipo, the fat transfer, anesthesia, post-op garments, BBL pillow, lymphatic massages. All of that comes in the package, and it ranges from about $10,000 to $15,000 for that BBL package. So it is very all-inclusive. So just for lipo, it begins at $1,500 per area. And lipo is something that you can possibly do awake or under local anesthesia as well, depending on what area you're wanting or how much excess fat you have. Very commonly, people will do their thighs or their arms under local, because it's like a smaller, more concentrated area. But if you're wanting like 360 lipo and you have a lot of excess fat, then we normally go ahead and do general anesthesia just to make sure that we're able to really get out all the fat without you being uncomfortable or it not taking too long because you're awake. So we actually don't do any sort of epidurals here. This is just cosmetic procedures. But we do have general anesthesia that we provide, and we also have Expra as well if you're thinking of something that's like pain management. I don't know if this patient is getting Expra. This patient isn't getting Expra, but normally we include Expra to help just keep the area comfortable that we've done all of the high volume lipo on. And that's going to time release some numbing medicine into those areas, keep the patient very comfortable post-op. But not everybody necessarily needs it. Everybody's pain tolerance is different, so not everybody needs it. Not everybody wants it. But it is something that is offered. So for 360 lipo, you would still need to go ahead and have a consultation so that we can evaluate you and kind of see what that's going to entail and how much fat you have, how long in the OR. All of those things kind of factor into your overall cost. We can offer you some starting prices and price ranges, but for anything customized like a mommy makeover or anything like that, you would still need to go ahead and have a consult. And again, we do offer consultations via Skype or WhatsApp if you're international. So if you're not local and you can't come into the office, that's not a problem. We can consult virtually. We can also have a lot of follow-up appointments virtually too. He's really working hard to really scrape out all of that excess fat and sculpt him out. So of course this procedure is being done on a male patient, but 360 lipo is very common for females as well. So we don't offer Vaser or J Plasma, but we offer Smart Lipo, which is very similar to both. It does a lot of cellulite reduction and skin tightening. This patient is actually also getting the laser lipo too. We normally combine it with a lot of our power assisted cases just to tighten the skin, melt more fat. Really good. So the laser lipo or smart lipo machine has the same technology as a J plasma or a Vaser. Good question. So fibrosis, it can sometimes be the technique of liposuction that the doctor used. Of course, you are still going to have scar tissue because it's a high volume lipo, so you are going to have scar tissue. But if you do your lymphatic massages and wear your post-op garment a lot, you won't really have any lumpiness or bumpiness or anything like that. We also utilize a liposculpture technique called blending. So after he sucked out all of the fat, he really smooths everything out to make sure that there is no lumps, there's no bumps. And of course, again, if the patient is, adhering to the guidelines and wearing his garment and going to his lymphatic massages, everything is going to be nice and, smoothed out with those lymphatic massages. Yeah, a lot of the times it is lack of massages, or sometimes it's how they do lipo. Everybody does lipo a little bit different, and sometimes that can be the reason too. The lack of lymphatic massages can be a major reason, because things just get hard, After lipo, your skin and your body is kind of like Play-Doh. You have to sculpt it out, you have to smooth things out. It's a really great time if you've had some loose skin. We offer Thermi Smooth post-op, and that uses RF heat to tighten the skin even more. So that can be another really great way to make sure everything is very smooth, everything is real flat, and your skin retracts. Great question. So right now, Dr. Park is also going in on the chest area, removing all of that excess fat and breast tissue so that whenever this patient has a nice flat tummy, his waist is going to come in and his chest is going to be nice and flat to match everything. So now if he did have a lot of excess breast tissue, we would go ahead and do a gynecomastia procedure, which is a male breast reduction or removal of excess breast tissue on a male patient. And we typically kind of divide those in major and minor. So for this patient, he really doesn't have a whole lot, so he would be like minor. Now, some patients have a whole lot more, and we'll have to do a cut and cut out that tissue, and it will be left with an incision, which we do try to monitor and take care of to make sure that it does fade out post-op. But he's looking really, really, really good. Definitely. I mean, everybody has an area that just the fat always wants to go there. It just sticks there and it's very stubborn. And that's kind of the fat that we want to target during lipo, or even if you're wanting like a fat transfer, like a BBL. That's the good fat that we want to go ahead and suck out and put that into your butt, into your hips, and let it be stubborn somewhere else, not on your tummy. So it's a really common area. But we understand, sometimes even with diet and exercise, we still have problem areas that our fat just likes to stick in. For a lot of people, it's the abdomen, it's the love handles, sometimes the bra rolls, the back area. We just tend to carry a lot of fat, particularly female patients. So he is really putting in those final touches all throughout this abdomen, removing all of that stubborn fat and sculpting him out. Alrighty guys, if you have any final questions or comments, we'll take those before we go off. After Dr. Park is done doing a lipo on, the power assisted lipo, he's going to go back in with the laser liposuction. Awesome. We would definitely love to take care of both of you. Alrighty, thank you guys all so much for joining us. If you guys have any additional questions, you can feel free to message us on Facebook or Instagram. Or of course give us a call or shoot us an email at info@georgiaplastic.com. Dr. Park is going to finish doing some more lipo on this patient, and then he's going to go back in with that laser, tighten up his skin, melt some more fat, and we will catch you all later. Bye everyone.
Enhance your look, enjoy your